Hey, in today's video, I'm going to show you how to treat a rotator cuff tear at home. There's 3 phases to treatment that I'll cover here in depth, and there's just a few pieces of equipment that you'll need. They're inexpensive. I've actually linked them all in the description below. Total should run you around $70, give or take, depending on the current prices. You'll want to bookmark or save this video, have a way to get to it really quick, just in case you need to go back and reference the exercises and the phases and the times. There's a lot of details in this video that you'll want to make sure you have written down or just have the video so you can reference it, so that you don't get lost on all the treatment times and all the reps and sets and all that stuff that I'm going to cover with you today. Now, it's just a few exercises. It's actually not a ton of exercises to remember, but how you do them is what's most important. And if you're not sure if you've got a rotator cuff tear, I've got another video called How to Tell If You've Got a Rotator Cuff Tear. It's also linked down in the description. So if you're wondering if this is even something you should be doing, go check out that video first. And of course, use your common sense and go get medical attention and go get a proper diagnosis if you're thinking that you might have a rotator cuff tear and you've never been diagnosed with one, you never had an MRI or seen a doctor for one. Real quick, my name is Dr. David Midoff. I'm a specialist physical therapist at Paso Manual Physical Therapy. And on this channel, we help people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. And if you're new to this channel, please subscribe and turn on your notification bell so that you don't miss out on any of the helpful tips that we put out every week on this channel. Now, there's 3 phases to fixing a rotator cuff problem. Phase number 1 is pain control. Phase number 2 is gaining motion back. And phase number 3 is getting strong again. Now, depending on where you are in your rotator cuff tear, you might have already been healing, you might be recovering, or you might be fresh, you might be very irritated as well. It could be also that you hurt your rotator cuff a while back, but it's flared up again and it's more fresh. The more severe the problem, the more likely you're going to start in phase 1. But as you go through the phase 1 exercise part of this video, if you feel like it's pretty easy for you and you may not need to do it, then go ahead and go to phase 2 or phase 3 if phase 2 is pretty easy for you. But I would just make sure that you are sure that you can do the exercises in each phase pain-free without any bad effects that are happening during or right after exercise or even into the next day. You should feel like you're getting better each time you do the exercises and take the advice that I'm going to give you here in this video. So phase 1, you're going to need one piece of equipment. It's a shoulder sling. So I've got a brand new one right here, and I've linked it in the description below for Amazon. There's generic ones, there's name brand ones, it doesn't matter. I've got a very simple shoulder sling right here. So this is like what you would put on if you injured your shoulder. And you may be thinking, well, I can move my arm, I can do stuff down here with my rotator cuff tear. And I understand that. The reason why I want you to put on the shoulder sling is because if you think about the tear, the tendon is partially torn or maybe even completely torn depending on how severe it is. What you're trying to do with this sling is shove your elbow up this way so that your ball and socket joint come together better, so that the tendon tear edges are brought together. We call that approximated, where they need to be brought together so that they have the best chance at healing. You know, just like if you cut your skin open and you go to the hospital and get stitches, you're gonna need stitches so that the edges of the skin are brought together and you can heal without getting a massive scar. Well, you're looking at fixing your rotator cuff tear without surgery, so this is what you've got to do in order to make sure that you don't get a big huge scar. All right, so I actually haven't played with this one. There it is. Okay, so this has got this Velcro here that you can use to tighten up, and it's important that you know how to tighten it up, because what you're going to be doing is get your elbow all the way into the corner of that sling, and then right there I feel like I've got a little bit of motion, but my arm's just subtly hanging down. It is supported, but I need it to be supported even better. So I'm going to get the Velcro off here. And there's different mechanisms that different slings have. Some of them have a little plastic clip thing that you can slide up and down. And what you want to do is not just pull your hand up this way, but kind of slide this around so that it shoves your elbow up. So now I'm shoved up right here. I'm just going to Velcro back onto the same strap. There you go. So I am slightly strong. I don't know if you can see my shoulders here, a little more elevated on this right side versus my left. My ball and socket joint are closer together, and my tendon now is in a position to heal. So you've got to do this as much as possible if your shoulder is hurting you quite a bit. If it hurts to just pick up your arm or do simple motions, this is going to be golden for you. It'll feel good for one thing, but the other things that it's going to do for you is it's going to force you to go through your day, doing your house chores, your cooking, your cleaning, all the things that you have to do, work, and not use your arm so much, because every time you use your arm, you're pulling that tendon apart just a little bit and not letting it heal. This forces you to heal a bit faster. The other thing that it does for you is people around you. If you have people at home or people at work or just people that you're running into throughout the day, they're going to be more inclined to help you open the door, pick up that heavy thing, whatever it is that you're doing, so that you're not using this shoulder more. You just got to rest it a bit. Now, you don't need to sleep in this. You can take it off. Some people want to sleep in it. That's fine. It's not a hard no. You can if you choose. You definitely don't want to shower in this. Take this off during the shower. And you're not going to only do this. I'm going to show you another exercise in just a moment that you'll do in addition to this. But throughout the day, whenever you're carrying on with your normal daily activities, your work, the rest of your life, you should be in this sling as much as possible. Now, the only other time that I tell patients to take it off is if you know you're not going to be doing anything. You're at home, you're relaxing, you're on your favorite chair, your recliner, whatever it might be. Maybe you're lying down, and you know you're just not going to use your arm very much. You can go ahead and slip it off. And as long as you're not going to do anything aggressive, you'll be fine. Your shoulders shouldn't be aggravated. Now, if you're sitting at a chair, what I would strongly suggest you do is shove some pillows under your elbow to create the same effect while you're sitting there. That way, you're shoving the ball into the socket gently, of course, and bringing the edges of the tendon together and letting it in. Now, the other thing that you'll be doing in addition to using the sling is this exercise that I call shoulder rotation. Real creative, right? I have a video for you. I'm going to play it in just a second, but what you'll need to do is lie down either on your bed or on the floor, anywhere where you can lie flat. You'll need a pillow. I'm sure you got a pillow lying around somewhere, or get a towel or something soft that you can roll up and place under your elbow. As you'll see in the video here in just a moment, you need to have your elbow up away from the plane of your body just a bit. The only reason for that is because when you lie down on your back, if your elbow comes down, your elbow will kind of come behind your shoulder, and that puts the shoulder joint in a position where it tensions the rotator cuff. But if you just move your elbow in this direction, then the rotator cuff tendons are going to be in a much safer position to do this exercise. This exercise should not be tiring. It should feel pretty good when you do it. So let's get into it. So I'm going to lie down here. I got a pillow. I'm going to put that pillow under my elbow, and I want my shoulder joint at about 90 degrees from my body. So then my hand's gonna be up, and you're just gonna slightly rotate back up to where it stops, and then down, and all the motion's going through your shoulder joint. You're gonna rotate forward and back. Right here on the front of the shoulder, you don't wanna let that front of the shoulder pop up. That's your stopping point. When you feel like that, where my finger is gonna pop up, you need to stop. You can't let it pop all the way up like that. Going back, it's no big deal, but going forward, you can't let it go too far forward. So use that as your stopping point. If it hurts to be at that 90-degree angle, you can reduce it down and do the same exact motion, still tracking the shoulder motion, so don't let that shoulder pop forward. So that exercise is golden for your rotator cuff muscles and tendons. Now, it shouldn't be tiring. You're not doing anything strenuous. I need you to do this exercise for 2 minutes at a time, real nice and slow, just an easy pace, maybe take a full second or two to complete the motion. And you're not forcing anything. If you feel pain going in one direction, don't push into it. Just stop from going that far the next time you go in that direction. You might just do a small arc of motion too. If that's the case, that's cool. Just do that small arc of motion. What you should find is that as your shoulder calms down, as a tendon tear calms down, you should get more motion. You should be able to move a little more freely. Now, you're going to be in this phase for anywhere from 1 to 4 weeks. We're still talking phase 1 here. So you're going to be using the sling and doing this shoulder rotation exercise for 1 to 4 weeks. This shoulder rotation exercise, I tell patients to do this hourly. That's usually the best option. If things will get in the way, of course, you got to travel, go to the store, go do things throughout the day, work, all that stuff. So play around with your schedule. Ideally, if you can get to doing this 8 to 10 times a day and spread out is ideal, then that's the best situation. Really, if you're thinking, gosh, I can't do this every hour, I completely understand. You've got to find how much of this works for you. And let me put it in some more common words. If you think of like medicine, like doses of medicine, if you pull out your ibuprofen bottle or your Tylenol bottle, it's got, 800 milligrams on there. That's this dose size that was calculated by pharmacists and doctors to know that that's going to be a dose that's going to give you the right effect. So you have to have the minimum effective dose is what we talk about. So if you think about the dosage of this exercise, we can't calculate it based on your weight and age and height because everybody's different sizes and they're at different points in their shoulder problem. So you've got to figure out how much shoulder rotation do you need to get the dose, the minimum effective dose to feel better. So it might be hourly for you. Maybe you can get away with doing this 2 or 3 times a day. I would say probably not, unless you're not that irritated. If you found that you can do this pretty easily, then you need to move on to phase 2. If you do this for 2 weeks and it gets easy for you, move on to phase 2. If you feel like you need another week, 3rd or 4th week, or heck, if you need to go a 5th, 6th, 7th week, as long as you track that it's getting better each week as you go along, hang out there and it's totally cool. You can do that. Now, if you're getting worse, this is pretty simple stuff. I mean, you're using a shoulder sling and you're moving your arm without weights or resistance or anything like that. It's just the weight of your arm. Then I would stop here and go see a medical professional because there might be something else going on besides a rotator cuff tear. You could have a labral tear, you could have arthritis, you could have a bunch of other things that just aren't allowing you to go through this program normally. And so that's okay. Go get the help that you need. But if it's helping you out, great. Let's talk phase 2 so that you can get the next piece of what you need. For phase 2, you're going to need to do 2 exercises. So you can start getting out of the sling at this time. Some people like to be in it a bit longer. You can kind of wean yourself off. You don't have to abruptly stop. If you want to just use it when you're doing more strenuous things or when you go outside and you're going to be around people that aren't familiar with your situation. Because think about it, if you're not using that sling, you might get bumped into, you might inadvertently use that arm, you might quickly use the arm to pick up something that was about to fall, and that's what the sling is preventing you from doing. If the sling was working for you and that rotation exercise was working for you, it should feel a little easier to move your shoulder. You should feel some decent improvement. That means that you're ready for phase 2. In phase 2, the 2 exercises you're going to be doing is a shoulder pulley exercise and a wall shrug exercise. I'm going to cover those for you here next. Let's talk about the shoulder pulley first. You need a door. I'm here in front of the door and I've got the shoulder pulley here in a bag. Remember that link for the shoulder pulley is in the description. So you take it out of the bag. It's a blue rope. It's got some handles on it and it's got this pulley thing with this black strap and this little cylinder at the end of the strap. Once you untangle everything, that little cylinder is going to go over the door and you're going to close the door with that strap over the top of the door, and that cylinder will hold the strap in place. Now this strap isn't super strong. It's not designed to hold a ton of weight, so don't let any kids hang from it. Don't hang up from it yourself very much. Just your arm weight is all that you're supposed to be able to tolerate there. So once you've got that shoulder pulley set, pull up a chair in front of your door. You might use a closet door. Just make sure nobody's going to open the door on you. Have the pulleys right in front of you here, and it's my right shoulder here that I'm going to be demonstrating. So when you raise your arm up, shrug as high as you can and then raise the arm up with the help of the left hand. The left hand is pulling down. So my eyes are looking at my hand here because when my hand reaches my eyes, that's when I've got to maximally shrug and then unshrug on the way down. So shrug on the way up and then unshrug on the way down when your hand passes about your eyes. Every time your hand passes your eyes, you either need to be shrugging up or down. You can do this on both sides. You don't have to just do one side only. You can do one side only. I care about strengthening that upper trap muscle, the shrugging muscle, the one that you're shrugging with every time you come up. And if you're doing this properly, it should feel fine on your shoulder. It should just feel like work on the upper trap muscle. You can do some holds as well as you get better at this. And it should be kind of strenuous as you're seeing here. I'm making a face here. Make sure you give it a max shrug and reach up as high as is comfortable for your shoulder. That pulley exercise is going to be golden for you. And what it's doing is it's because you're pulling down with the other hand, the hand that's from the shoulder that's not hurt, you're going to be helping the other hand up so that your shoulder doesn't need to use the full brunt of the muscles. Your tear doesn't have to be tensioned all the way. You can assist it with your other hand. But you're now starting to shrug so that you're taking tension off the rotator cuff tear as well using your shrugging muscle, because that's what we need to get stronger in the long term to make sure that your rotator cuff tendon heals and you're not having to have a surgery. So this exercise requires quite a bit of reps. What I love to recommend patients start with is 10 minutes at a time, 3 times a day. You can spread it out throughout the day. Some people will work 15 minutes in the morning, 15 minutes in the evening. You generally need a lot of reps. And it's an easier exercise because you're getting some help. And it's okay to take breaks, by the way. Some people will just do 10 reps, where they shrug up and down, 10 reps, and they'll rest for a minute or two, and then they'll do it again. And just do about 10 minutes worth. You should feel tired in this shrugging muscle whenever you're doing that exercise. It should not hurt your ball and socket joint where the rotator cuff tendons are. The way that you know that you're getting better at this is you feel like you can go up higher with less discomfort. And let me make something super clear. Every time you raise your arm up, you should be starting to shrug and maximally shrugging at the top, with or without the pulley. That's what we're going to go into here in a minute. But I want to introduce that idea to you now. So once you start getting better at this pulley exercise and you're not helping yourself as much, you need to be shrugging every single time you come up, because we're going to go into another exercise in a second. We're going to be forcing that shrug to happen even harder. It's just going to be shrugging from here on out, but I'll show you how to progress it safely so that your rotator cuff is healing along the way. So we're still in phase 2. The second exercise that I want you to worry about is a shrugging exercise. Now I want you to begin to add this one in after you're comfortable with the pulley shrugging exercise, because you've got to be able to raise your arms up a little bit on this exercise. So it should not hurt to bring your arms up in the position that you'll see here in a moment. The point of this exercise is to really strengthen the upper trap muscle, the shrugging muscle, whereas with the pulley, it's to get motion back, well, strengthening that muscle just a bit, but the emphasis is definitely more on getting the full range of motion back. So it's not necessary to be done using the pulley yet. These two exercises can overlap. This exercise, the shrugging exercise that I'm going to show you next, should be done about 3 times a day. You can do it more often. In some cases, I'll tell patients to do it 5 or 6 times a day. Really, you need to do it as much as you need to get these upper trap, the shrugging muscles, tired without hurting them, without causing any pain where you feel like you need to take, Tylenol or ibuprofen. And it definitely should not be hurting your rotator cuff shoulder. Let me show you the exercise. It's going to be a bit intense, so pay attention first before you try it out. So find an empty wall. You're going to need to put your arms up against the wall and bring your elbows to about shoulder height. Then you're going to maximally shrug up. You're trying to get your shoulders up to your ears as high as you can go. Hold it there for 10 seconds. And after about 10 seconds, you can come on down. And what I need you to do on this exercise is make sure every time you shrug up that you're going as hard as you can. I don't know if you can see it in my eyes here, but I start to squint. You should feel like you're going up as high as you possibly can. Now it's okay if you feel like you need to slide your arms up like I did right there. It's fine if your arms slide up and down or stay in the same spot. You don't want to do that though. You don't want to tip your body back, and you don't want to shove your head forward or look down. You don't want to be looking down on this. You need to be looking straight at the wall and have a little bit of a baby double chin when you do this. This exercise is critical at strengthening those upper trap, those shrugging muscles. And those shrugging muscles are very important to take pressures off your rotator cuff tendons so that you don't tear this again, so that you allow it to heal first off, and so that you learn how to move properly and have the right strength in the right areas, so that you're not re-aggravating this tendon, this rotator cuff tendon, and then tearing it again in the future. Because I don't want you to have a surgery, and I don't want you to be chasing doctors to give you injections or prescriptions for pain medications because your shoulder still isn't better. We do this with patients all the time, and we use these same exact exercises in this sequence, and they consistently get better, and to the point where they're doing everything they were before and more. They're exercising with their shoulders, but they've got to start here with these shrugging exercises. Now let me just wrap up phase 2 for you. So you're going to stay in this phase for anywhere between 2 to 6 weeks. That's usually the range that we use. Like I said at the beginning of the video, if you found that these exercises are pretty easy for you, then you can move on to phase 3. But I do want to caution you to at least stay on phase 2 for just a bit. If you skipped phase 1 and you're testing out phase 2 right now, that shrug can be pretty intense. It looks like an easy exercise, but even for people that aren't that irritated in their rotator cuff tears, they have a hard time. They're shaking and starting to sweat after doing 10 reps like that, holding it for 10 seconds. because that's what I want you to do. Hold it for 10 seconds and do 10 reps. You're going to do this several times a day, 3 times a day, 4, 5, 6 times a day to get the strength going in your upper trap muscles. The reason for 2 to 6 weeks is because during that time frame, you should theoretically get the strength through the upper traps necessary and the nerve connections to the muscles so that you're using the muscle more efficiently to do the next phase, phase 3. So hang out there as much as needed. If you want to peek at, I want you to look at phase 3 so you know what you're getting yourself into in case you're considering skipping phase 2. But I just want to caution you, I can't stress it enough. Most people are probably going to hang out in phase 2 thoroughly before they go on to phase 3. So let's talk phase 3. In phase 3, the number one thing that you're going to be doing is improving your strength in those shrugging muscles. We're going to start to add some weights here. I've linked a weight set, a small hand weight set in the description below. Of course, you might already have some hand weights or you know somebody that you can borrow hand weights from. That's cool. You just need some small weights. And if you're looking at just getting started right now because you're ready for phase 3, use some cans. One 16-ounce can of soup or peas, whatever you have at home, is about a pound. So you could use that to start out. Once you feel like those shrugs have gotten easier, then you're ready to start adding some weight. And so what you're going to do, I've got some weights here that we use here in the clinic. These are 3-pound weights. You're going to start out with 1-pound weights or 2-pound weights. If you feel like you can do the 3, then just be confident that you can do the 3. And all I want you to do, I'm going to step back here so you can see me a bit better, is just like that pulley shrugging exercise, like that wall shrug, you're just going to put your arms in a comfortable position with the weights about in front of you right here. And you're going to shrug and reach up and go up as high as you comfortably can, maintaining a full shrug. Remember, don't let your back arc up, don't let your head stick out, don't let your head look down. You should be doing a little baby double chin and then holding a shrug for 10 seconds, just like that. After about 10 seconds, you can come down and you're gonna repeat that 10 times. So of course, start out with the small weights, 10 seconds. And then after 10 seconds, I'm gonna just go a little faster here, come down. Now it's okay if you're gonna start out this exercise for the first time to do no weights, just to see how your shoulder moves. And if you can come all the way up, hold it for 10 seconds, and that's okay, it's not hurting your shoulder, then you might hang out there for a bit just to get comfortable with the motion and then add the weights. But if you're doing that with no weight and it hurts you, you need to go back to phase 2 for a bit. Hang out on the pulleys a bit longer and do that wall shrug a bit longer. You need to do exercise that doesn't aggravate your shoulder, because then you're going to be tearing that rotator cuff tear a little bit more and not letting it heal as fast as it can. So don't come to phase 3 until you're ready to reach all the way up with no discomfort. And of course, you should be shrugging as you reach up. So let's talk frequency now. So we talked with the shrugging exercise and the pulleys. Those need to be done about 3 times a day. This is going to only be 1 to 2 times a day. Now you can do this more often as long as you feel like it doesn't hurt you, but because you're strengthening now, rather than working on the range of motion, this is pretty much pure strengthening. You need to do it a little less frequently so that you can allow your body to rest. The effect that you're looking for is for these muscles to get tired. So just in case you do the 1-pound weights and you're doing the shrug 10 times, holding it for 10 seconds and doing 10 in a row, and then you're doing that 3 times a day, like I'm telling you to do here, and it doesn't feel that challenging, then up it, please. You don't need to follow my guidelines. Just like I'm telling you, you need to feel like you're getting your upper traps, these shrugging muscles, tired. So do 4 or 5 sets or 6 or 7. You got to go to the amount of sets that feels appropriate for you. You could try holding 15 or 20 seconds each rep. You might need to increase the weights. You need to play with the variables of this exercise so that you get the effect needed, the dosage needed of strengthening. So remember, just one more time here, we're gonna be comfortable like so. Shrug as you're reaching up. Make sure your chin is tucked in just a bit. Hold it for 10 seconds and then come on down. And increase the weights as you feel comfortable. So that weight set that I linked in the description, it's got a pair of 1-pound weights, a pair of, I think, 3-pound weights, and then 5-pound weights. And you have a little ladder. You don't have to get that. You can get, they sell hand weights, dumbbells that are adjustable that you can put the weights on and off. That's fine. Whatever you want to do. I've had some patients go make weights out of concrete. They're good at making things out of concrete, and they know how much it weighs, and they'll use that. Whatever you need. I just need your upper trap, your shrugging muscles to get stronger. The stronger you get in those muscles, the less irritation you should have here, the easier sleeping at night should be getting. And at this point, if you're in phase 3, you should be feeling like you can use your arm a lot more. Naturally, you'll probably be using it more, and that's good as long as it's not painful. Use your arm. That's exercise as well throughout the day. Go do your chores, go do your yard work, your housework, and don't be afraid to use the arm as long as it's not hurting you. If you do get some discomfort, back off, wait a little bit longer, get a bit stronger first with these exercises, and then get back into trying it again later on after you've gotten stronger. Now, this phase typically lasts another 2 to 6 weeks, depending on you. And what I would highly recommend is indefinitely keeping up some strengthening. So as you progress to those 5-pound weights, like I recommended with the weight set, if you're able to hold for 10 seconds, 5-pound weights should be 10 pounds total. After that gets easy, then you're ready for reps, which means you're going to be coming up and down, just like that. If you're at that point where you feel like you can come up and down and you're shrugging effectively every single rep and your neck is in control every single time, you're not getting sloppy with it, you're good to go on that exercise. What I need you to do then is work your way up to doing 50 reps continuously. You could take small breaks, you could do 10 and then rest for 30 seconds, a minute or two, and do another 10 and do 5 sets of 10 like that. And work your way up to 100 reps. If you can do 100 reps, within say a 10-minute time period or something like that, whatever is appropriate for you, that would just be a once-a-day exercise for you. And you would do reps. It'd be a workout for your upper traps. What is good to get up to is about 10% of your body weight, 100 reps. If you can, so for instance, if you're 150 pounds, then if you can do 15 pounds total between both hands, 100 reps, a few times a week, because you would do this realistically like a workout routine, like 3, 4, 5 times a week. That's pretty good strength. As long as you're doing it with good form, shrugging your shoulders up, and your shoulder rotator cuff injury isn't hurting, you're going to be maintaining your strength very well so that you can do whatever you need to do in life without worrying that your rotator cuff is going to tear again or become aggravated again. I would encourage you to get even stronger than that, to work your way up to 20, 25 pounds or more. It would depend on the level of activity that you're going to be doing. If you're going to be exercising, if you're going to be doing any sort of long-term weightlifting or heavy aggressive work at home or in the yard, then I would go up to 20, 25 pounds or more, regardless of your body weight. If you're 250 pounds, then you better be at 25 pounds. You got to figure out what's appropriate for you. But the thing that's the same, that's constant, is you got to get stronger in these upper trap muscles. So that wraps up phase 3 for this rotator cuff healing program for home. What I haven't talked about here that you need to know is that if you were to be a patient in the clinic here, we would be looking at the joint movement and the ball and socket movement. There are some cases where there's some arthritis there. There's other complications inside the shoulder joint. There might be a biceps tendon tear. There's nerve problems that can also feed into the shoulder pain. It might just be more than just a rotator cuff tear. If you feel like you're still dealing with some symptoms, but you can do all the exercises, that may be part of why you have those symptoms. So just be aware, you might need to see a specialist for that. They may need to do some techniques on you, or you might need to get some treatment. You need to figure out what is needed in your specific situation. But if we're talking about healing a rotator cuff tendon, these exercises here, this approach that I've given you, the sling, the pulleys, the weights, are golden for healing a rotator cuff tendon. So if you have any questions, please drop a comment here. And if you like this video, if you thought it was helpful, please give us a thumbs up. And don't forget to subscribe and turn on your notifications if this is your first time on our channel and you're not a subscriber yet, so that you don't miss out on any of the helpful videos we put out every single week. Thanks so much for watching, and good luck on your rotator cuff recovery. Have a great day. Bye-bye.